We're facing a personal care services crisis around the country. The surge in enrollment of individuals in these programs is stunning. So shocking, we have to double check our numbers. We don't think it's possible that it's happening, but it is. In California and New York, the #1 job in the entire state is personal care services. Guess what? It's good to be home, because it's true in Pennsylvania too. 50%, dramatically more people serving in the personal care services space, that's home care, than is in retail. That's where Pennsylvanians are going. It's becoming a jobs program. Medicaid fraud in this state is costing taxpayers for care that was never delivered, or even worse, harmful. It's costing patients their health, their trust in a system that was built in a high-trust environment, a place we all thought that we would be able to be safe, because who would steal from the poor? As Colin outlined, many people, unfortunately, are doing just that, and we're coming after them. What we're exposing today is a diabolical breach of trust, a violation of the sacred bond between patient and caregiver. It is a catastrophe that can only be dealt with in the way we'll be outlining for the rest of this presentation. Today's defendants included an aide who billed Medicaid for care claimed to be delivered while they were in jail, or while they're being arrested, or while they weren't in the country. The list goes on and on, one more disbelievable than the next. And it's not just individuals. There's a home care agency, 2 owners who are charged with billing Medicaid hundreds of fabricated clock-ins. Again, care that was never delivered at all. And we have evidence of that. CMS's job is to make sure this money reaches the people who actually need it. That's the grandmother who desperately needs this money to stay out of a long-term care facility. It could be a vet who relies on this to get help because he's stuck in bed. All these individuals deserve our love and support, not the criminals who have hurt them. We've reviewed Pennsylvania's personal care billing trends. I'm going to give these numbers to you slowly because they're really important. This is the federal government's data on Pennsylvania. Pennsylvania ranks 5th nationally in average monthly payments, both per beneficiary and per provider. That is way out there. Be #5 in both those categories. More expensive, that is, in 45 states. Over 96% of personal care claims here are illness unspecified. That's how they're titled. So we can't track them. It doesn't help if the U.S. Attorney or the Attorney General can't possibly find the fraud, because people aren't actually telling us what they're really doing. We have to change that history that's evolved here into the norm. And finally, average payments per beneficiary, more than $50,000. Think about that, $50,000 per person getting home care in this state on average, far above what you'd ever expect. All this points to fraud. The cases like these are exactly why a whole government approach is so critical, and why we have to develop best practices of how to evolve this system. You're going to be hearing from Dan Brillman in a second. He runs Medicaid. He's going to touch on another problem that's a big one in Pennsylvania, which is autism care services, and why they're, again, not only are they off the chart in Pennsylvania, but the rest of the country, but we are actually here to help. We're giving you a toolkit that will allow the state to be able to tell what's good, what's not, what's foul, what's fair, so we can identify the best use of our funds.